may have heard that people say minorities are more hesitant to get the COVID-19 vaccine, and thought to yourself, well, yeah, there's a good reason for that. And you know what? You'd be right. History shows us lots of examples why minority groups don't trust the medical profession. The Tuskegee study of untreated syphilis in black men without being informed or treating them. Between 1973 and 1976, 4 Indian Health Service regions sterilized at least 3,406 indigenous women without their permission, according to the National Library of Medicine. Now later, I will introduce you to a clinician who can talk more about this. Now, studies do show that implicit bias has led to many disparities in how doctors treat people of color. However, studies are also telling us that minorities are getting COVID-19 at a higher rate and the outcomes are worse. So what do we do? Well, I got my COVID shot for one simple reason. I didn't want to get sick or die. I think it's time we fight for our lives. Now, I understand that it's a personal decision, and I personally talked with my doctor to help me make that decision. So now I think it's important for you to hear from VA clinicians of different ethnicities and professions who are doctors, nurses, even a pharmacist who mix the vaccine, to get their professional perspective on the COVID-19 vaccine. But first, you might want to learn a little bit about their personal stories.
I did get the vaccine, and I will say I have my mother. She actually does have some underlying conditions that make her more vulnerable. My mother lived in an era where most people have heard about the Tuskegee experiment. So there's a lot of hesitancy in the African American community about a generation ahead of me.
My husband is in Las Vegas. That's our primary home is in Las Vegas, and we have not seen each other for a while because of this COVID. And I told him, no, I don't want to fly.
I also have anxiety around needles. I was sitting with my mom, realizing like, I get this from my mom. I've had all this fear of anxiety. It must run in the family because I do the same thing. I get sweaty, I get clammy, my heartbeat starts to change.
I want my patients to be taken care properly, and I just want to protect myself and protect the life of those who are under my care, including my family members.
I decided to get the vaccine because I wanted to be able to serve my patients and be on those front lines and not be afraid. Also, I've not been able to see my family and my friends for so long. And even with my mask and the hand sanitizer, I needed to make sure I was using every tool within my power to protect them.
We know they all got the vaccine, but what did they tell their patients?
Yes, I strongly recommend, the patients to take the vaccine first, because we have a privileged population of patients that have served this country, and they deserve, to be served back with this vaccine, to be protected and be protecting also the life of their loved ones.
I recommend the vaccine to all of my patients, even if you are a woman of childbearing age, if you're pregnant, or even if you're breastfeeding. Coronavirus is very dangerous, especially in women who are pregnant and especially in women who are breastfeeding and taking care of young children. So far, there were people in the vaccine trials that were not pregnant when it started, but they did get pregnant at some point, and there have been no complications for them.
To me, as a physician, especially as pathologists, I think all of us should have a vaccine. It's very critical and important that we have to protect our elderly as well as our veterans, and most of them are, elderly and with different sickness or comorbidities. And these are very critical in the disease process of COVID-19.
So I do recommend the vaccine for my patients. I really see a lot of veterans take the extra measure to take care of themselves. They come to the appointments early. They, walk, exercise. They have daily routines that really geared towards a good quality of life. Because of that, right, this vaccine would be really helpful, and I think it'll help our quality of life in the long run.
And what do they tell their family and friends?
There's a famous quote, "When America catches a cold, Black America catches the flu." What we do know right now is that minority communities have very high rates of infection, and that's increasing our rates of hospitalization and death. Right now, the best tool we have is the coronavirus vaccine. So I would urge everyone to have in-person conversations about all of their personal concerns.
Hispanic and mostly Black people, they're more prone to develop some symptoms more than other, counterpart, like Caucasians. I strongly recommend them, to take the vaccine whenever it is available to them. They should not fear any consequences. They should not fear any side effects in the long run. The only side effect that they can experience is having a long and prosperous life.
But I think in the COVID vaccine studies, they made a big effort to include more African Americans. And so there are a higher percentage in these studies, but there's still always room to grow. But I do encourage folks to get the vaccine. They have to weigh out their own pros and cons and make sure that the benefits outweigh the risks. But generally, I feel as though it will help our whole community if we have more people vaccinated.
With the Asian Pacific, most of the time in a household, mother, grandparents, parents, and then the kids and then grandkids, they live together. The younger ones, they might have the COVID-19 virus, but they are asymptomatic. And this elderly, they have lower resistance. Even just a small dose of the virus, they can get really very sick.
This virus just impacts us so differently that our genetic makeups all vary, and for some reason it may impact certain groups more. So I really think this vaccine can be helpful in that way, is to at least lessen the symptoms.
What an impressive group of caring medical professionals. No surprise to those of you who received care at the VA. They shared a lot of good reasons to get vaccinated. As someone who has spent his life on a soap opera, I'm always interested in those personal stories. So let's go back and revisit our clinicians' personal stories. Did Dr. Cephas' mother get vaccinated? Did Dr. Ibanez Manlapaz get to see her husband?
She actually got her second dose yesterday, coincidentally. So very proud of her for doing that.
So now he just got his second dose. I told him, okay, 2 weeks after your second dose, then I'm going to visit Las Vegas and see you. So we have not seen each other since the pandemic, can you believe? But we do FaceTime.
I'm sharing this because I volunteered to get the vaccine shot early on, only because it has impacted me in so many ways, right? I've been, at least for the Navajo Nation, we've lost so many. I know with the relatives that I have, I come from a very large family on my mom and dad's side, but I've lost 7. Sorry. I've lost 7 relatives. And one, she prolonged medical treatment because she didn't want to get sick. So she may have had some hope treating her symptoms if she went sooner.
Before we leave, I want to bring you back to where we started, history, and the discussion about the Tuskegee experiment. I learned a lot about what Dr. Cephas had to say.
One thing, a lot of folks in my generation actually still have the reasoning that they won't take the vaccine, pretty much from hearing a lot of the stories probably from their parents and grandparents and things about the Tuskegee experiment. Yes, there were some things that were done that were definitely wrong with that, but also there were a lot of different regulations and laws put in place to help prevent those things from happening again. If there are healthcare professionals that go through studies and know the paperwork and the things required for what's called an institutional review board, you'll notice that there's a lot of things that have been put in place to help prevent advantages taking over of vulnerable populations. And a lot of people are unaware of that, and I think that goes to a lot of the mistrust that's still out there.
Yes, there is history that tells us about injustices in the medical profession. There's also the history of vaccines and how they changed the world for the better, many in my lifetime. For example, polio. For many years, parents would not let their children go swimming in a public place due to their fear of them getting polio, a debilitating disease that took away the ability to walk or breathe. In 1960 alone, there were over 2,500 cases of paralysis reported. The vaccine was discovered in 1961, and in 1965, there were only 61 cases. In 1994, it was eliminated in the United States. Smallpox killed about 30% of those who caught it, and often left facial scars on the survivors. In 1979, the World Health Organization declared smallpox was eradicated worldwide, which was possible by widespread dissemination of the smallpox vaccine. Now, we are all familiar with many more diseases reduced or eliminated by vaccine. Today, depending on your age, these diseases are something that we might remember from our childhood or from our parents' stories. But there was a time when the fear of these diseases were as normal a part of everyday discussion as COVID-19 is now. It's important to take a step back and realize that we are part of another historic moment, one that we have the ability to impact.
We've had to adjust and modify to make it this far. Our ancestors have done their thing to get us to this point, and I think this is our way of continuing also to hang on to what we have.
The truth is, all of us have been locked away for over a year now. As with Dr. Ibanez Manlapaz, we've missed seeing loved ones for birthdays and holidays, missed the birth of many family members, missed paying our respects to loved ones who have passed, and miss saying goodbye to loved ones who have died alone. We must all be responsible for community immunity. This is not something that someone else can do for you and your family. This is something that each individual has to be able to do. And in fact, as veterans, this is nothing new to us. We know all about stepping up for the greater good. I ask you at this time to step up once more for yourself, your family, your neighbors, your country, and literally the world. Vaccines save lives. I leave you with this thought. It's important to remember the past, but we must live in the present and work toward the future. It's time we fight for our lives. Get vaccinated, stay distant, and mask up.
And just to plug, because I am a pharmacist, pharmacists are basically the most accessible healthcare professional in the community. So you can't go anywhere and just walk into a store and ask anybody a question except for your pharmacist for free. So you can actually go down the street to a CVS, a Walgreens, anywhere, and find a pharmacist and ask them questions that can help you in making those type of decisions if you can't talk to your physician or any other healthcare professionals.